exactly is midlife, first of all? So this is the central period of the person's life, usually between the ages of 40 and 60 or 45 and 60.
शिवानी ये प्लीज ये हाइड वाला दबा दो, ये बीच में लाइन आ रही है आपकी
अच्छा
तरफ।
अच्छा, हाँ, सॉरी. Now, experience of pregnancy in late 30s or 40s, it is not just something you see celebrities doing, but it is more and more happening in our patients also. If we see, we don't have Indian data, but if we see data from CDC from 2000 to 2013, 14, they say that the percentage of births to women who are 30 to 34 years, and this was their first child, increased by 28%. And although in India it is not allowed, but in 2013 in US, more than 677 births to women 50 and above. And again, this is the same data which has been represented. This graph, the lines, they are curving little bit on the right hand side. That curve just means that the age at which people are having their first children, women are having, is slowly going up. And why are we seeing these trends? Greater financial stability, emotional preparation, flexibility with work schedules, established careers. And in India, the biggest reason is increase in median age of marriage, higher school enrollment of women. Inconvenient biology. Now, what are the advantages and disadvantages of being a first-time parent in your midlife after the age of 40? So this was an in-depth qualitative interview which was conducted. And the advantages, women, I mean, you will be surprised to see the biggest advantage that they said was not financial or stability, but emotional preparedness, because they till then they felt that they were not emotionally prepared to have a child. So emotional preparedness was the 72% of women, then career, work, financial security, and they perceive that they have a strong partner or family relationships. And what were the disadvantages? That most patients, of course, will need IVF, energy levels are low, less lifetime with children, smaller family size, and of course, there is always this stigma attached of being older age of parenthood. Now, we have more women pursuing higher education, career, postponing marriage. There are simple and effective contraceptives available, problems in finding a suitable partner, increased prosperity. And the biggest thing is there is a misconception about the effect of age on fertility. In general, we all have a longer and healthier lifespan with increasing use of ART. Take a look at this questionnaire. Karen McDougall published in Human Reproduction 2013, and some of the findings are so surprising. 30% of women think that fertility will decline very slowly and gradually till around 50 years. 31% they expect to get pregnant without any problem at all at the age of 40. In fact, they are shocked and alarmed to discover that there is an age-related reproductive decline. And 28% said that we should have more fertility education, in colleges or in your 11th or 12th. Then we have, 46% of women acknowledge that even if they had better information, the life circumstance will not have allowed them to begin childbearing earlier. Now, why this reason for mistaken belief? First of all, people feel if they are healthy and they have a family history of fertility, then their fertility will last for a long time. They get sometimes incorrect information from friends, physicians. They see in the newspaper, in the media, women are getting pregnant, celebrities at a later age. So this all leads to misconception, career orientation, late marriages, and delayed childbearing. Now, what about the biological clock? As we all know, women are born with 1 million eggs, and this is all the eggs that they will have in their lifetime. Fertility starts declining, and almost end of fertility is between 40 and 50 years of age. And this age has a great impact on decrease in fecundability. So if you see the study between 30, 31 years and 32, 33 years, fecundability does not differ that much. But after 34 to 35 years, this decline is sharp, and it is the sharpest after the age of 40, where it is anywhere between 50 to 60%. and how many attempts you are going to need to get pregnant. What is the time to pregnancy by age? So if you are in the age range of 30 or 31 years of age, you can see the number of attempts. It is hardly going to be 1, 2, or at the most 3 attempts. But the dotted lines which are there, 40, 41, even after 12 attempts, it is not assured that you may achieve a pregnancy. And of course, this is the ethnic difference also, that we are all aware that there seems to be some difference between ethnic races. Caucasian race, Indian race. In Indian race, there seems to be a 6-year difference in favor of Caucasian races. So you see AMH level, AFC count, gonadotropin doses are higher required in India. Now, what are our marital fertility rates? So at the age of 20 to 24, it is about 6%, and between 40 to 44, it is almost 64%. What is the impact of age on fertility? As we all know, the percentage of IVF cycles when you start, what is the probability of live birth after the age of 44? It is only 1%. And this is really an eye-opener. When I open this graph and I show it to patients that, look, you are 40 or 41, your chance is 12%, 5%. So this is really an eye-opener for patients, where they get a realistic idea that, okay, so this is my probability of pregnancy. And in this study, what they did was that they compared the clinical pregnancy rate and also the spontaneous abortion rate with the live birth rate. 45, 46, 47, these ages, what they found was that the live birth rate was almost nil at this stage. And in fact, the CDC has presented that over the age of 42, if there is a pregnancy, the miscarriage rates are extremely high, more than 35, 40%. Not only that, advanced age also has other problems like gestational diabetes, preeclampsia, cesarean delivery, preterm birth, even ectopic pregnancy. Age is an independent risk factor. And also for medical conditions like leiomyoma, tubal disease, endometriosis, or polyp, age also increases the risk of these diseases. And there is a particular group which is at increased risk, that is ovarian surgery, chemo or radiotherapy, severe endometriosis, smoking, infection, and strong family history of menopause. Now, there is a Delphi consensus that we should all know by. What is Delphi? Delphi means that respected experts, that is, the very respected people have sat down and they have made a consensus statement, which is called as a Delphi consensus statement. So what is important in this statement is no effect of patient's age in oocyte donation cycle according to Delphi. So it is only the effect of the age of the egg donor which matters. And there are other things like women less than 40 years, maximum 6 embryo transfers should give you a pregnancy. PGTA with comprehensive chromosomal screening will shorten the time to pregnancy. And if you have failed fresh IVF, Delphi suggests that you should do an immediate frozen embryo transfer. In poor ovarian responders, they suggest dual stimulation, agonist trigger to reduce the cycle cancellation, GnRH antagonist protocol. And as you do accumulate, that is accumulate the number of oocytes, increase oocyte means increase pregnancy. Now, in order to have more than 90% chance of achieving a family, if IVF is acceptable to you, you should start no later than 32, 27 or 23. And if it is not acceptable, then even if you want a 2-child family, you should start early. You should start at 27 years of age if you want a 2-child family. Now, coming to the topic for today, advanced maternal age and IVF, fertility, present and future treatment. There are 4 main subheadings how we tackle this problem of fertility in midlife. First is prevent it, second, solve it, third, compensate, and fourth, reduce. So what are these 4 strategies? Prevent. How? By doing oocyte cryopreservation, social campaigns, education, so that there is awareness about the impact of aging and lifespan on fertility. How do we compensate? We maximize ovarian response, rescue oocyte competence like mitochondrial spindle chromosomal complex or pronuclear transfer chromosome therapy. How do we solve the problem? Oocyte donation, or for futuristic purpose with pluripotent stem cells, generation of new gametes. And how do we reduce this problem? By agonist trigger segmentation of cycles, single embryo transfer by doing pre-implantation genetic testing, or you can do the metabolomics, which means a non-invasive testing of the embryos. So first option was prevention by oocyte freezing, that is the reproductive insurance. It reduces the incidence of oocyte donation and burden of ineffective fertility treatment at older ages. And most of the patients who you're going to get are either they are married, they are optimistic, they are waiting, they are in their early 30s, they know they want kids together, but they want to wait 5 to 10 years more to focus on the career and choose to freeze the egg or sperm or embryos. Or if a woman who is single, she's ready or she's not able to find a partner, pretty sure that she wants a child later, but she's putting off kids to focus on the career, but has the financial means to freeze her eggs. In fact, the number of egg freezing cycle, which was zero, we were not doing any such cases, has increased not only in the US 2009 to 2015, but also in India. And headlines were made when Facebook, Apple, they said we are giving $20,000 to our employees so that they can freeze the eggs. So this policy, they wanted that we should have a level playing field for both our male employees and our female employees. And this was the study. Before 2013, what happened was egg freezing was considered to be experimental. It was not accepted as a standard treatment option. But when studies were published which showed that frozen egg success rates, live birth rate is almost the same as fresh egg success rates, then frozen eggs was taken out of the purview of research and accepted as a standard of care of treatment. So women in their 20s and 30s should be counseled about age risk of infertility and should be aware that natural fertility and success rate is significantly lower if you are more than 35. And for this, you can have reproductive health education like ovarian reserve testing for women, or you can have risk factors like chemo, radiotherapy, previous ovarian surgery, poor responders who go for ovarian reserve tests. But there is a lot of caution for this, because if you just think I will test the general population and find out what is their ovarian reserve, you will be disappointed, because in the general population you will find many women who are low ovarian reserve but getting pregnant naturally. So this is ovarian reserve testing is not for a general population, but for a limited population. You cannot tell the person that if it is low, you will always have difficulty. Many people get pregnant naturally in a low reserve without any great difficulty also. Now, the pregnancy rate for controlled ovarian hyperstimulation is lower if the woman is above 40 and should consider IVF if they don't conceive within 1 to 2 cycles of ovarian stimulation. And a woman with decreased ovarian reserve should be offered oocyte donation as an option because the pregnancy rate is significantly higher. To compensate, maximize the ovarian response, improve the the oocyte competence, that means rejuvenate the oocyte, because this more number of oocyte means more number of euploid blasts. Don't think that more oocyte will mean more abnormal embryos. It is not like that. This Calamaria Ubaldi oral presentation, Eshrei 2015, euploidy rate was absolutely consistent across the number of M2 oocytes increase. And in fact, as you have higher ovarian response, there is no jeopardization of pregnancy rate. And there is increase in cumulative pregnancy rate. Even Fatemi has shown this 2013. And if you want to know how many eggs to freeze or how many embryos should be there as a reproductive insurance, this is the chart to use. So if the woman's age is less than 37 years, less than 37 is the green line. I know it's a little difficult to see, but it seems to be that all the lines when they are reaching 1 or very close to 1 is somewhere between 12 and 15. So it seems that between 12 to 15 embryo seems to be a perfect number to be frozen. And if you are freezing eggs, if you have almost 80-90% fertilization and embryo rate, you can take this as a guide for number of eggs also to be frozen. And if your patients who are coming for egg freezing are older, they are amongst a low prognosis group, then you should divide them as Poseidon criteria, group 1, 2, 3, 4. And what Poseidon says is 5 strategies: use recombinant FSH in preference over urinary FSH, increase the dose of FSH, give recombinant LH supplementation, do use DHEA before ovarian stimulation, and combine your follicular and luteal phase stimulation called as dual stimulation. Now a word about ovarian rejuvenation. So there was this lot of studies I was reading to prepare for this presentation, that there were a lot of studies which were done in 90s, but these studies are never published, because what happened was people were doing in the West mitochondrial transfers, cytoplasmic transfers. This is going on since 90s, but there were cases where babies were born with anomalies. So to avoid scandal, this was never published. Then we have the first baby. This is mitochondrial transfer as a complementary technique to ICSI to improve embryo quality in a patient going IVF. This was the first study which was actually published for mitochondrial rejuvenation, in which the mitochondria are given from a donor oocyte into the oocyte of the patient. You can have total cytoplasm transfer, or you can have even a spindle transfer. Now the first baby by mitochondrial transfer was for Lee's syndrome. So it was Chinese doctor who was basically American, who went to Mexico, did treatment for a patient from Jordan. And they went to Mexico because the regulatory framework was very lax there, so they were able to do this mitochondrial transfer. In UK also, now the first third parent baby has been born. So these are some things which are more in research, and more they have a lot of issues and debates around them. How do we solve? By a simpler solution is oocyte donation, of course. Third party reproduction, especially if there are several. If you do PGT testing also, it is very frustrating. Sometimes you get all euploid embryos, endometrial receptivity is good, but multiple failures. So then the only option which is left is adoption or donation. And in advanced age, this is the committee opinion from ASRM, that you should have a complete medical evaluation before attempting to transfer embryos in women over 50, and should be strongly discouraged or denied, and discouraged above 55 years of age, although they don't have a cutoff of 50 years as we have in India. Now, autologous stem cells, Dr. Poonam, as she mentioned, that a word about this, that there is some role of autologous stem cells or platelet-rich plasma in rejuvenating, because many times we have seen that after this, the AMH value, I mean, patients with 0.1, 0.4, the AMH becomes maybe up to 1, 0.8, 0.9. So definitely there is some benefit, but we don't know. With 1 or 2 cases, it is not possible to make a complete conclusion. So these are all options. Earlier, this used to be done by catheterizing the ovarian vessels and injecting into the ovary directly. Now we are just using like the Verries needle, kind of a long needle, pitrescent needle, to inject a PRP or autologous bone marrow cells into the ovary. CRISPR technology, which has come to correct the defective sperm and oocytes before formation, resulting in defective embryo, they can be corrected by using this bacterial enzyme Cas9. So this was one of the exciting research areas that we should know about. PGTA, to minimize the risk of advanced maternal age and avoid the transfer of aneuploid embryos, increase our pregnancy rate and less burden of complications. With PGT, there are a lot of studies which are published, and miscarriage rates are supposed to be lower, delivery rates are better, mean number of embryos transfers that you have to do goes down, and time to pregnancy increases. And as per the comprehensive chromosomal screening, that is CCS, which is now done, first, there was this microarray and other techniques which were used, and now we are using this NGT, next generation, or CCS, comprehensive chromosomal screening, as a part of PGT testing. So here the clinical error rate of aneuploidy was found to be very low. The predictive value is 96%, but it is very important that we should counsel the patient that this is not 100% accurate. In fact, when I'm doing the PGTA, I give the form of the company, that this is the literature of the company, and you please sign that you have received the literature, and even the company's form. So I give it to the patients and tell them, you decide after you have a read of all this information, because sometimes they may say it is normal and in pregnancy there could be some problems. So we have to always be very careful nowadays. What about paternal age? I was speaking so much about maternal age, but even for paternal age, the trend of older parenthood is true for men also, and there is reduced testicular volume, testosterone, erectile dysfunction, decrease in semen volume, increase in the semen DNA fragmentation, and autosomal dominant disorders. Especially there are these autism, neurocognitive, psychiatric disorders, even malignancy has been linked with this. So preconception counseling, the risk of spontaneous pregnancy loss, chromosomal anomalies, appropriate prenatal screening should be done when the pregnancy is ongoing, and always pay attention to the risk of pregnancies and promote optimum weight and health. Screen for concurrent medical condition like diabetes and high blood pressure. Advanced paternal age is associated with spontaneous abortions, with even intrauterine fetal some stillbirth cases also, autosomal dominant condition, autism, schizophrenia. So men who are above 40 and their partners should be counseled about this potential risk when they are seeking pregnancy. This is one of the reasons that not only egg freezing, we can also promote sperm freezing among men before the age of 40 years. Education, enhanced awareness about the effect of fertility. Women who are older than 35 should have expedited evaluation and treatment after 6 months of failed attempts. And women who are more than 40 years, there should be immediate fertility evaluation. Now, age is a fluid concept. You know, one person is old physically, mentally at 35. Somebody says, I'm young and hard. Women live now into their 80s. Many cultures, I have seen patients who come to me from Sudan, literally at 50 years of age, they are having a child. I mean, they say there are many women who are I've seen the children also. 50 years of age, the woman has conceived and had a child. So there are many cultures. Sometimes you see many variations. And the Indian Council of Medical Research, ICMR, advised an upper age limit of 50 years, and now the ART bill also states it's only up to 50 years for women and 55 years of men, because there is a fear that women's bodies at older age cannot cope with multiple hormonal intervention of IVF. There is a risk of bereavement, there is a risk of psychological, social, financial burden on the children. So there was a need to have an appropriate authority, appropriate policy, age limits for us as per our life expectancy. And not only that, there should be a psychological assessment. It has been recommended as policy making that there should be assessment of the home situation, legal undertaking by responsible family member like a nominee for financial and social legal guardianship and protection of the children born to mothers of advanced medical age, and it should be legally binding in case of bereavement. So conclusion, we can say that woman has a right to have a baby which is based on what is medically safe, not like a social judgment, and the patient should be carefully selected and managed. There is rigorous health campaigns and awareness programs are required so that patients don't face this difficult scenario. And we must always have in mind a backup or an insurance plan. It is said that older parents owe their children thoughtfulness and care of parental plans for sheltering their child within a capricious world. Thank you everybody for this wonderful opportunity, especially Dr.